Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to this edition of Pregnancy to Parenting as we continue our episode in part 2 looking at your newborn, not realizing that there's so much to talk about when baby comes home or just when baby's born, understanding the development, the different stages it is going through just within those first few weeks. We welcome once again in studio Dr. Rabin Lachman, our pediatrician based out in Cape Town at the Rondebosch Medical Center, giving us his advice when it comes to your newborn. A very good day to you, and thank you so much for joining us again.
Thank you very much, Hawa. It's nice to be back. Yes, a lot to discuss.
So much we didn't even realize.
We didn't even touch base.
Okay, so last we chatted about baby's weight and baby's growth.
Yes.
And looking at latching onto that is of course a big one, which is baby's development and what is happening with baby, the stages it goes through, even within that first few weeks. And where do we really start? Is it from day one?
Okay, yes, Hawa. So baby's development starts from day one, and the baby's brain is developing at a very rapid pace in the first year of life. When we talk about development, we tend to divide them into different groups.
Okay.
And what we divide them is into what we call the gross motor skills, which is the movements of the large muscle groups, which helps to get baby from being immobile to mobile. Then we look at the fine motor skills, which is the movements of the fine muscles of coordination in the hand, how baby is moving his hand to get to become functional. The next group of development is the speech and hearing. So speech goes with language, and we'll talk about that. And then the last is the social interaction, how baby becomes aware of his surroundings and interacts with his surroundings.
It's funny how all of that affects the different throughout the baby's life from day one, because when you talk about social, we know baby is looking at you, or baby is reaching to see what is happening through its eyes. When we talk about gross motor skills, I don't quite know where that would, where in the stages would fit in, but maybe we can start from day one.
We divide it into different groups, but we must remember that all of it is developing at the same time, all together. Okay, so starting with the gross motor skills, it is getting the baby from the immobile position to sitting up independently, crawling, and then pulling to stand, walking along objects, and then walking independently. That is the first year of life. That is taking us through the first year of life's gross motor skills. And that is, there are certain time limits as to when baby must achieve these motor milestones. And for example, at 3 months the baby should have head control. At 6 months the baby should be sitting. At 9 months should be crawling, and at 1 year should be pulling up to stand. Now it is very important for the listeners to understand that when we put these age limits on, there are what we call median ages, where the average child, or 50% of the child, would have achieved this milestone. However, there are what we call limit ages, when we feel that if the child goes beyond this age, or beyond certain months, and has not achieved that milestone, then it is a delayed milestone, and we need to see as to why the baby is delayed.
So when you say delayed, would take us back a month or two, or a few weeks?
So each one has a median a median age as to when the average child achieves that milestone. For example, sitting independently, the average child will sit independently at 6 months, but the limit age is around 8 to 9 months. So if your child is not sitting by 9 months, then you need to see your doctor and decide and get him evaluated and see why is there a delay in the milestone. So this is mainly the gross motor skills. So when we move on to the fine motor skills, these are the muscles of the smaller muscle groups, which allow baby to become more functional. that is allowing the baby to move his hand together towards the midline, at 6 months to hold his bottle, and at 9 months to get the pincer grip developed. That is where baby is able to pick up objects. Fine motor development is the development of the fine muscle groups to allow the baby to become functional, and some of these milestones are at 6 months, with the baby moving his hands towards the midline to hold his own bottle, and at 9 months to develop the pincer grip to pick up an object such as the spoon, and then at 1 year to put a block onto another block. So pick up something and put it into a plate. And these are a very important fine motor development in the first year of life, which has repercussions later in life. The pincer grip is very important for handwriting at school age, and it is very important that you develop these fine motor skills early on in life. Moving on from fine motor development, we move on to speech and language and hearing, and it is very important that your baby responds to sounds, startles to a loud noise, and this is right at the beginning at 6 weeks to 3 months. And if your baby is not responding to a door banging or a loud car going by, then there might be there might be some issues with the child's hearing, and this needs to be evaluated urgently. When it comes to speech development, it is very important to understand that it starts right from the beginning, right from day one. And speech is divided into what we call receptive language and then expressive language. And receptive language is understanding speech, and then expressive language is speaking. And it is the receptive language which develops first, and then the expressive language. So baby understands what is a book first before he says the word book. Okay. So it is important that this is continuously stimulated throughout, right from the beginning, that receptive language is stimulated in order for the baby to develop his expressive language to start speaking.
Wow.
Social interaction really starts also right at the beginning. The baby gives you his first social smile at around 6 weeks, which is great, and he starts to fix and follow, meaning that he starts fixing and interacting with his eyes with mom, and this really starts at six weeks, going right to your first year when he waves goodbye.
So are you saying then, when baby's smiling at you and when he's just born or she's just a few days old, it's not really a smile?
It's not really a smile. The general smile comes at around 5 to 6 weeks. Maybe before that it's just a bit of wind. But yes, social smiling starts at around 6 weeks.
So wait a month and you know for sure. All right, so looking at newborns when they're coming home, what would you say in all of that, whether it be the gross or fine, and as you're saying it develops right from the beginning already, but within that first few days or even the week, what is newborn, both gross, fine, social, and speech and language? Where is baby at within those first few days, and what can baby do?
Okay, so in the first week, as I mentioned in the previous episode, it is very much about bonding and feeding.
Yes.
So that is where we are in the first week, and then slowly this starts to change, and as baby develops, becomes more interactive, and starts becoming more interactive with their mum. So it is very important for mommy to start right from the beginning to stimulate him, to talk to him, to interact with him. In the beginning, in the first couple of days, it is mainly sleeping and feeding, and when they
changing
nappies. And when they are awake, it is important for mommy to interact with them and speak to them and engage with them in order to stimulate them and increase that awake time, so that they are getting to be more interactive with mom.
Now, I've heard the importance expressed on tummy time. and I want you to talk to us a bit about that.
Yes.
You know, you've mentioned the 3-month stage when baby's neck
Yes.
starts becoming, you know, more stationary and firmer. So would that be about the time to discuss tummy time?
Yes, that would be about the time to start what is called tummy time. So tummy time is putting your baby on his tummy so that he can lift his neck up and extend. And this is sort of to start allowing the baby to do some push-ups. Okay, so he's basically going to put his hand down, extend his arms, and lift his neck and strengthen these muscles of the hand. It is very important for baby to have tummy time in order to strengthen these muscles. If the baby is lying on his back the whole time, he's not going to strengthen these muscles. Allowing the baby to be on their tummy stimulates the baby to strengthen their muscles, to promote them to start crawling.
Okay.
You know, soon the hands start moving and then the legs start kicking at the back, and soon they are going to be mobile. Tummy time starts at around 3 months, and this is also the time when baby turns from what we call prone to supine. That's when he rolls from his back to his tummy, or from his tummy to his back. This is an important time during development, and it is very important for mummies to be aware that this happens at around 3 months, because it often catches them quite unaware, and baby becomes very mobile very quickly.
This for me was very interesting throughout my baby's stages, and looking at, you know, having that safe environment and how we can push them to having and you know, enjoying their tummy time. Is there any advice around that, you know, being there? And as you said, mommy needs to be aware that it happens around 3 months. Besides being aware, what can we do with regards to safety and, you know, having the area okay, and you know, pushing them to do the exercise?
So the best place to stimulate a baby, or when you are playing with the baby, is to be on the floor. So get a nice clean mat, get a rug, get on your knees, get on the floor, and play with baby on the floor. The other advice I can give you is, when baby is lying on the bed or in the crib or on a changing station, then not to leave them unaware. You know, mum always, you know, she's busy changing a nappy, and then it's, I forgot the wipes, you know, in the nappy bag, which is across the room, and then she quickly runs, leaving the baby unattended, which is not advisable at this stage, because baby is getting much more mobile, and, you know, can very easily, that situation can turn very horrible very quickly.
They move really fast.
They move really fast, and they catch mums unawares.
Okay, so we're talking about tummy time and baby's development, what you can do to initiate that, and we want to talk also more about, you know, how mom can push for baby's development, not necessarily push when it's not advisable, but doctor has given us some guidance as well when it's a bit delayed, when you need to see the doctor. So more after the short break. Stay with us in part 2 of your newborn, and so much more to discuss. Assalamu alaikum, welcome back, a very good day to you. Thank you so much for joining us and staying with us as we chat about your newborn. If you can remember what it was like taking your baby home or just coming home with your little one, please do tell us. Visit our Pregnancy to Parenting Facebook page, share your story. You never know who it might touch and who you might egg on to tell their story. I'm Kowa Solomon. With me is Dr. Rabin Lachman, based out here in Rondebosch, Cape Town. He's giving us some vital advice when it comes to the baby's development. Didn't realize that so much is going on with baby.
So much is going on. Hey, he's doing lots of hard work.
Yes, within the first year, but yet within that first week, in fact, it's entering the new world and growing rapidly.
Yes.
We want to also help with that growth, and helping with that growth involves mommy. We just heard how mommy needs to get on her hands and knees, literally see the baby, what the baby's world looks like from his or her eyes at about 3 months, to strengthen the neck control and tummy time. Very important. I've always heard that, tummy time, tummy time. So, and also remembering to keep baby's environment safe. Let's look at how we can enhance that development and ways and means.
The thing that most parents get wrong when it comes to stimulating a child's development is they think that they need to go out and buy the most expensive toys, the most expensive mobiles, and stimulatory toys, and they get caught up in this market that is out there, thinking that they need to get the most expensive in order to stimulate their child to be the most clever and the most developed child that is on the block. But that is incorrect, and the best that two parents can do to stimulate their child is to spend time with their child. So it is to engage with your child and to play with your child, and this is very important for both mum and dad to do. So it is not just the mum's responsibility to play with the baby, it is the dad's responsibility as well. And the best thing that you can do when you come home from work is kick off your shoes, get on the floor and play with your child. And when you are playing with your child and you are engaging with your child and you are talking with your child, you are inadvertently stimulating that child and stimulating his or her development. So if you are on the floor and if you are playing with cars, you are talking to your child, you are engaging with your child, you are stimulating his language development, his hearing development, his social interaction. If you are playing with cars, you are playing with the car in a circular motion. He is playing, he's stimulating his pincer grip over there, and you are moving across the room, so you are stimulating fine motor coordination, gross motor coordination, all in one go. And it is you just spending time with your child. Nobody else can do it, it is only you. You, mom and dad, who should spend as much time with your child engaging with them.
So let's not get confused and take advantage of the monopoly out there, but going to buy the most expensive toys. And
I really don't think that is very important. Simple toys, simple plain toys, and you as the parent, that is the best development that you can give your child, is to spend time with them. And then reading. I cannot stress enough how important it is to read to a child. And it is very important to start reading actually when you find out that you are pregnant, actually. So it is right before baby is born. And this is a very good bonding time for mums and dads. And I think dad reading to baby while he's still in the womb is a very important bonding process. Baby gets to hear his dad's voice, he gets to recognize it, and when he's out of the womb, he immediately recognizes and remembers this voice that was reading to me in the womb. And then continuing to read from day one. Every day to read to baby is vitally important. To keep baby close to you, he finds that comfort, he finds that safety, he finds that security, and then he engages in the book. You are stimulating him on multiple fronts by simply reading to him. Reading is vitally important. It starts from day one to stimulate language development, and baby starts babbling at around 3 to 4 months, cooing and interacting. And it's very important and it's very interesting that babies' sound of the coo sort of follows the mum sound as she is speaking in the different baby voice when she's speaking to baby. So baby also starts making those sounds and innuendos. And those are the first initial steps of language development. The first word comes around 9 months to 1 year. And then language really progresses in the second year of life. that's when language development really starts kicking in. The expressive language starts to come in, and by 2 years of age, baby is putting 2 words together, stringing his first sentence.
So hopefully by 2 years, that book that you kept reading over and over again, the baby will be actually reading it themselves without even actually reading. Because I've seen that.
Well, hopefully. You shouldn't put too much pressure on your child, but if he at least points to the book and says one word, then you have achieved enough. You have achieved a great milestone if he points to the book that you've been reading and recognizes the pictures.
I've got an adult though that tells me the story of her whenever she goes to gatherings of recitation. She falls asleep, and her mother would egg on her. How can you fall asleep? You must be awake and join in the recitation. And she says, you know what? I can't help it. You always used to recite this to me when you made me to sleep.
Exactly.
So I just can't help it sitting here falling asleep.
So those are associations that are formed early in life. Baby associates certain things with certain habits. So if mum sings to baby to put him to bed, then that's how baby is going to go to bed every day. And when he hears a song, then he's going to fall asleep.
Okay, so reading, very important.
Very
from the
important.
Beginning.
I cannot stress how important this is, even before the baby is born. And it is very good bonding period for dad and mum before the
big birth.
Yes, the big birth and the life-changing newborn that's going to come and change everything in this environment.
New person, that comes in.
So it's a nice time for mum and dad to spend together.
The baby is there, just inside, but bond in that way as well.
In that way.
Absolutely. So a very big thing for me is bonding, because I know the focus is within the first few weeks is bonding and soothing baby. I must say that as much as moms are afraid of how do I handle this baby, it does also come naturally. But how is it that some moms are able to calm their baby through just one cry? And sometimes, if there is a problem, then the baby will of course continue to cry, and you would know that cry when it's a problem or not. But the whole essence of bonding and soothing baby and knowing baby's cries, how can both parents do this together as well?
So it is it is very important that mum becomes comfortable with baby and dad becomes comfortable with baby, and babies pick up on that very quickly. They will pick up when mum is stressed and they become more stressed. So if the baby feels that mum is stressed out, baby is going to get stressed out. If mum is cool and calm and collected, then baby feels safe and secure. And right from the beginning, it is very important to engage with baby and bond, and a very good way of doing that is skin to skin contact. Having the baby close to you on your skin, baby is hearing your heartbeat, hearing your sound, listening to your voice, and getting to know your scent. And this is also very important for dads. Dads can also do skin to skin contact, allow baby to just lie on their chest and get to know them. So this is very important, because when baby is distressed or crying, then dads can simply pick them up and put them on their chest and start talking to them, and baby immediately feels comforted. He feels protected. He knows this space, he knows this scent, he knows this voice. And dads have this special technique. They have a deeper voice. There's much more vibrations going through the chest wall, and baby is very in tune with those vibrations, and it really calms and cools the baby.
It's so true, because if I think back of how my husband used to just have the baby lie on his chest and he would and the babies would fall asleep. So that's amazing. It makes sense now that you explained it. Okay, so another question is crying before we go to our break. How intuitive, are we moms really when baby is crying, knowing that, listen, okay, this is a nappy change, or it's a bit colicky, or it's not feeling well, actually, baby's just tired.
All right, so mommy will get to know her baby's cry, and mommy and daddy will get to know baby's cry. She will know the difference between a cry which means pick me up and cuddle me, or a cry which is please change this nappy now, or I'm going to throw my toys out of the cot, or a cry of hunger. Okay. Different to a cry of pain. So mummies get to know these cries, and they get to be very in tune with their baby. Also, when in the newborn period baby is crying, mummies need to go through a certain checklist of what can it possibly be, and that it is not necessarily always that baby is hungry. And this is often a mistake that mums make, is that every time the baby cries, the baby gets fed, and inadvertently the baby becomes actually overfed. So it is important that when a baby cries, that mum needs to go through a few things and see, why is the baby crying? Is it another reason apart from hunger? Is the baby cold? Is the baby too hot? Does the baby need a nappy change? Does the baby just want to be picked up and cuddled? Just want to feel that he's not the only person in the world at the moment? There's various other causes for a baby to be crying other than hunger.
Such a long checklist to go through. All right, so hopefully that's why we've been granted the patience, alhamdulillah. But stay with us, as I want to touch on an important subject when it comes to soothing. Do we pacify, have aids in pacifying or not? More after this short break. Assalamu alaikum wa rahmatullah. Welcome back. A very good day to you. Thank you so much for joining us and staying with us as we talk about your newborn. If you are listening to the show, at least watching the show, and it's taking you back to bringing your baby, your first few babies home, we'd love to hear your story. So please post them on our Facebook page, Pregnancy to Parenting. In studio, we have Dr. Rabin Nachman. He is based out in the southern suburbs in Cape Town, and we're talking about the development stages. We're still going to get to the very inner part of immunization, so stay tuned. But just before the break, I mentioned pacifying or not. Let's hear a doctor's opinion on that. I know it's quite controversial.
Yes,
a lot of people have
controversial. So what I usually tell my parents is that I usually give them the pros and the cons, and I allow them to make their decision. Okay, so it's a very personal decision, and I feel that one should not judge a parent for what decision they make. They are ultimately going to make the final decision. So starting off firstly with the cons of a pacifier. And the main and major con for me as a medical personnel is that it poses an infection risk. So if the pacifier falls onto the floor, it picks up germs, and then that pacifier is picked up and put into the mouth. It's just, you're exposing your baby to a wide variety of germs, and they can pick up gastroenteritis very quickly, and apart from other illnesses. So that's one of the major cons and the major concern for me from a medical point of view. And I think, if parents do choose to use a pacifier, then they should be very aware of this, and, make sure that they have a clip on, for the baby's pacifier, so that when it comes out of the mouth, it doesn't fall onto the floor. And to be a bit, take care about the hygiene of the pacifier. The pro of a pacifier, I would say, is that it's mainly you know, if a baby has just fed and you have excluded all the things that we have discussed about when baby is crying, and really the baby just wants to soothe, and the mum is at her ends with, then yes, I would, you know, really agree with giving your baby a pacifier, because I think the mum's mental health is very important. And if a pacifier soothes the baby and allows the mum to be in a better mental state, then that is much better for the baby, to have a mum in a healthy, good space, good mental space, in order for her to take better care of her baby. Then yes, please give your baby a pacifier, because I want a healthy mum.
I must admit, I opted for the dummies.
And good for you, Khawa, good for you. Nobody's judging. You, I think, would have been a better mum with a baby who was soothed.
But naggy. Okay, all right. So the big one, immunizations. And kind of left the best for last, or almost last. Take us through the scary immunization procedures. What happens? Why, you know, we actually choose to do it, and the type of
Okay, so immunizations is very important. It is very important, as far as I'm concerned, you know, there's no controversy around immunizations. It's simple. It must be done, and there is a schedule. And as far as I'm concerned, you know, mummies shouldn't be too concerned about immunizations. Your baby can be much more harmed from not getting an immunization than getting the immunization. So there is an immunization schedule. It is rolled out by the government. It is offered free by the government, and it takes place at birth, at 6 weeks, at 10 weeks, and 14 weeks. Those are the first batch of immunizations, and then the next one is at 9 and 18 months. And thereafter, you know, there are various catch-up vaccines that the child can get. Vaccines are very important because they prevent life-threatening diseases, and if these diseases are not life-threatening, they can cause serious damage to the body and consequences thereafter. For example, polio can cause serious neurological illness. What we think is a simple disease like measles can cause a brain infection called encephalitis. Something like rubella can cause serious congenital abnormalities in the child, and so on and so forth. There is a batch of immunizations against very, very serious diseases, and these immunizations provide some sort of protection to your baby. So if your baby is going out there into a war zone, immunizations give some sort of armor or protection against these deadly viruses and bacteria that are out there.
Okay, so that kind of answers the questions of why it must be done, and what happens, at least now the next question is at least what happens if parents decide not to do the immunization.
Okay. If parents decide not to do the immunizations, personally I feel that they are doing their baby a great deal of you know, injustice. They are exposing their baby to quite severe viruses and bacteria out there, which can cause serious illness. Okay, and you know, immunizations are very important. They provide protection for the baby, and they you know, give the baby as much support as they can get.
Okay, so take us through the actual immunization, the stages, because I know it happens within the first month.
Yes, so there is an immunization schedule that is derived by various studies and experiments and research as to when the baby can get immunized, when that immunization will mount an immune response in the baby and provide protection for the baby in the earliest possible time period when the baby is exposed to these illnesses, to try and prevent them from being from getting the disease. So there is a schedule, and as I mentioned, it starts right at birth.
Okay.
So at birth you get the oral polio drops and the BCG vaccination, and then at 6 weeks you get a batch of injections and an oral polio drop, and this continues at 6 weeks, 10 weeks, and 14 weeks.
Okay.
So that is the first
polio.
batch of immunizations per se. And then the next one is at 9 months and 18 months.
Okay. So quite a few weeks that baby needs to visit the clinic for their polio drops and
this is, a good time not only to check in for immunization, but for a general check-in with a healthcare professional, be it your pediatrician or a nurse, when baby is going to get his or her immunization, to get a weight check, to get a feeding check, to get a developmental check, to see that baby is on par with his growth and development.
Because that's what I noticed. The first thing you come to the clinic or the doctor, undress your babies, mummies, so we can weigh them. Yes. And there's a whole queue. Okay, so immunization is very important.
Very important. I cannot stress how important they are, and it is more dangerous to not immunize your child than to think about side effects of immunizations. Okay. They are very minimal side effects of immunization, and if they are short-term side effects. They are not long-term detrimental side effects. You can get more injury and more harm to your child if you don't immunize your child.
Okay, so definitely big more cons and big more pros, much more pros than what they are cons.
As far as I'm concerned, there isn't any cons.
Okay, good. Thank you, doctor. All right, so dad's role in all of this, as we spoke a little bit earlier, and he can contribute most definitely to putting baby to sleep. And as our focus is bonding and feeding, let's talk about dad's role, even from, like you mentioned, putting baby to sleep to actual nappy changes.
Yes. Okay, speaking as a dad myself, I think I had to fight my wife to take care of the baby. It's very important for dads to bond with their babies, and as I've alluded to earlier in the interview, to start bonding before baby has even been born. And continue with this bonding after baby has been born. Dads, and there is a change in the role of the dad to dads 20 years ago. Dads are much more involved these days. They're ready to get in there and do the nappy changing and do the feeding and do the bonding, and they really want to be more involved and hands-on dads than what it was 20 years ago. So I'd encourage dads to continue to do so and get more involved with everything, every single thing that you can do with your baby. It is a bonding and it's a bonding experience and opportunity. So even if you're nappy changing, you're nappy changing and singing and interacting with your baby, and you are bonding and engaging with that baby. And sometimes dads feel, I get to go out to work and I come back tired, and mommy's here, on maternity leave, and that they miss out a lot with their babies. And so when they do come home, they want to spend a lot of time with their babies. They want to get involved with the bathing of the baby. And some dads have a specific role that bath time is my time with the baby, and I remember that was,
I do night shift or something like that.
And that was my thing, bath time was my time with the baby. Mommy doesn't come into the bathroom, it's dad's time. So
daddy prepares everything.
Daddy will bath you, will sing with you, will read to you in the bath with the bath books, and you take baby out, you change baby, and that is my time, because those were very precious times that I had with my baby. It was the only hour I had, in the day. One-on-one with my baby. So I really wanted to get in there and, be involved. And I would encourage dads to do that, to get involved right from the beginning. And what I do with my dads, you know, at the delivery,
Yeah.
especially with cesarean sections where mum is recovering from a Caesar, then to encourage dad to bond with the baby and do skin-to-skin contact with baby.
That is very important. Thank you so much for putting your stance to it, and big up to you, Dr. Lachman. We continue more about talk more about the sensitive bits when it comes to baby skin, and you know how to care for baby skin. Very delicate, soft. There's nothing like baby skin when baby's just been born, and any little one, of course. But more after the short break. So stay with us. Assalamu alaikum, a very good day, welcome back, and we're in our last segment, and just as I said, there's so much to talk about when it comes to your newborn, and we're going to try our best to encompass it in today's show, the second part that we pushed through with your newborn, and I'm sure after this there's going to be lots to discuss as well. But so please do suggest any program content or production on our Facebook page. We'll definitely be sure to add it in our list. So now we will be touching, as I said, on the very delicate bits of Baba. In studio we have Dr. Lachman giving us some great advice. Just before the break we spoke about pros of immunization.
Yes,
let's just stick to
only
that.
Pros.
Okay, so baby skin, so sensitive, so soft, so gentle, and as you mentioned, bath time is a very important time when it comes to bonding as well. That's one of the first things we are taught before leaving, besides latching and caring for baby. Bath time is of utmost importance of how to know to bath baby before you even leave the hospital. So let's just discuss that.
So most hospitals do a show bath with the mums before they leave the hospital. So you give your bath at the hospital and there's a nurse that guides you through it. And this is very important for first-time mums, you know, who don't know or have not experienced this before. So an experienced sister teaches you how to bath the baby and how to care for the baby during the bath time. They can become very slippery and you've got to be very gentle and careful with them. When it comes to taking care of baby's skin, it is important for the viewers out there to realize that baby's skin is very gentle and you need to use very gentle products on the baby. So I'm not going to promote specific products, but always take care as to what you buy and what you read and what advice you get when it comes to the skincare products of the baby. You need to use very, very gentle products, especially if your baby has sensitive skin, or especially if you have a family history of sensitive skin. If the oldest sibling or if mommy or daddy has a history of eczema or any skin conditions, you have to be very careful as to what you are going to use on this baby's skin. Try and stick away from products which have a whole lot of ingredients in it. Much more natural products, fragrance-free products are better for baby. So be careful with what you buy. Not necessarily the most expensive product is the best product. So be careful with what you buy. Very gentle products, you're dealing with very gentle skin. What I would strongly advise all mums to do is to get a good nappy cream. So I advise my mums to use nappy cream after every nappy change, because I feel prevention is better than cure. So you do want to prevent a nappy rash before it has already started.
Okay, that I know is a subject on its own, but we are talking about skin, how to get rid of the very irritated nappy rashes. So possible. So now let's talk about possible skin problems or irritations that could occur at the early stages. I encountered cradle cap, a heat rash. I've heard about
yes, so there's various skin conditions that can take place in the newborn period, and it is my best advice to you is to get it checked out at a pediatrician or a doctor to make sure that that you need to exclude that this is not a medical condition, or this is a benign condition that you can just manage conservatively, meaning with no medication, or whether you need medication for the skin condition. So always discuss it with your pediatrician or doctor. Go in, get it checked up, and put yourself to ease, so that if it is a condition that needs treatment, then proper treatment is prescribed and started earlier. A rash or with a fever is always a worrying cause, and that always needs to be checked out by a doctor. So there's a wide variety of rashes and skin conditions that can occur in the neonatal period. Most of it is benign, but I mean that it is not very harmful to the baby, and it doesn't need specific management. But there are certain conditions which do need urgent management and urgent treatment of. So always, if you are unsure, rather go and get it checked out.
Okay, so just take us through some of that. I know with cradle cap, it needs attention, but not necessarily, complete medical care.
Yes. So sometimes it does need medical care, and you need to be prescribed a shampoo which helps with the baby's with the baby's head, and sometimes you may need a steroid to reduce the inflammation. So go and chat to your pediatrician about it, and see that you have the correct medication or products prescribed for your baby.
So what I found very interesting was when baby's just born, their skin starts peeling, and as you said, they could just be benign. And for me, that was one thing that just they said, don't worry, that's baby. Just what is that about with the baby's skin peeling?
So most babies' skin peel after they are born, and it's new skin that is being developed, and especially if baby is born what we say post-mature, that is after 40 weeks of gestation, then they often get peeling of their skin, and it's simply their skin is regenerating and new skin is being formed after they are born.
So with one of the things of caring for baby skin, we have a picture of baby skin peeling. It looks very, it doesn't look any invasive or hurtful or harmful. So
no, it doesn't, and it needs it just needs a good skin care and skin products, and chat to your pediatrician about it.
So another scary bit on baby skin is the umbilical cord, how to care for that. We are so achy about it, looks extremely anal, not wanting to clean it or touch it, even to clean it to touch it. Just give us some guidance around caring for baby's umbilical cord.
Most commonly what we use to clean the umbilical cord is what we call surgical spirits. And surgical spirits are used to clean the umbilical cord with the cotton wool or cotton wool bud after every nappy change. So every time you change a nappy, you clean out the umbilical cord. The umbilical cord should fall off by day 20, so within the first 3 weeks, the umbilical cord falls off on its own, and it's all to do with the baby's actual immune system, which dries up that cord and allows it to fall off. Yes, and we do see cases of where the umbilical cord or stump becomes infected, and that's where it becomes red and inflamed and pussy, and this is as a result of a superimposed infection that has taken place. So it is very important to pay attention to cord care and clean it after every nappy change, and the best thing that we use to clean it is surgical spirits. I
think I've got one of my baby's umbilical cord somewhere there. I don't know why I kept it. One day I just went through some rubbish in the bathroom and I found it. So maybe if I can try and think of which child it belongs to, not too sure, but that's one of my secrets. Okay, so umbilical cord weight. One thing I wanted to latch on with regards to the umbilical cord, I've seen babies at clinics, and I saw one day an umbilical cord protruding quite
Yes.
basically
So
out. So what is that?
What we call it then is an umbilical hernia.
Okay.
And this is because of a break in the muscle of the abdominal muscles. There's you have abdominal muscles, and there's a break in the muscle which allows the cord
To stand out and protrude.
to stand out and protrude a little bit. And it depends as to how much it protrudes, whether or not an intervention is needed.
Okay.
A mild umbilical hernia resolves on its own. Sometimes, if it's quite severe, it may need surgical intervention.
Sure. Yeah. Some of them look quite scared. It looked like there was a part of a bump.
So it's a bit of bowel that protrudes through that weakness in the abdominal muscle.
Yeah. Okay. Right. So that's cleared up. Lastly, I want to touch on, well, not lastly, but yeah, almost lastly, we've got a few minutes just to wrap up, on your comments on old wives' tales, granny's advice versus what doctors have to say and the medical professionals.
So what I often tell my new parents is that, you know, a mother-in-law is actually, with a newborn baby, a pot of gold. Okay, so you definitely need an extra pair of hands around the house, and they really provide a lot of support to new parents. And the advice that they give you is often very well-meaning. Most of the mums really want the best for that child, and the advice that they give you is really, you know, what they think is in the best interests of the child. When it comes to administering certain products or medicine to the child, then I think it's best to discuss it with your pediatrician, because some home remedies are not so kosher.
Nicely said, Doctor. Right, unfortunately, that's where we have to leave it. And I love how we ended off with that beautiful, you know, putting mother-in-law and moms in that extra hands that is there for us to invite them and let them be a part of, you know, wanting to just, mom, chill out, take a nap, just hand the baby over.
Yes.
Thank you so much, Dr. Rabin Lachman. It was an absolute
It's
pleasure
been a
having you in studio with us today with some great advice. And I think as we round up, I hope, inshallah, you'll be back with us and looking at the prem babies, taking prem babies home and what's happening with them as well, because that's also another scary story.
Very scary. And mums are often unprepared, and it catches them unaware.
So definitely looking forward to that show. So stay with us as we do that show. A very good day to you, and thank you so much, Dr. Lachman, once again. And we'll hopefully see Dr. Lachman back soon again as we tackle the topic of premature babies, you know, taking them home and what's actually really happening with mom and dad during that time. Thank you, shukran again for staying with us on Pregnancy to Parenting. Please join us for another exciting edition, same time on a Tuesday morning at 10 a.m. with a repeat on a Saturday at 10 a.m. as well. From myself, Hawa Solomon, wassalamu alaikum, and a very good day to you.